Know your fertile days. In today's episode, we shall be looking at female reproductive cycle and its associated anomaly. This, and this. Commonly or frequently asked question: can a female conceive during her menstrual flow? Follow us in today's class and you'll have an answer to this question tonight. Alright, in today's episode, we shall be looking at female reproductive cycle. So what do we mean when we talk about female reproductive cycle? When we are talking about female reproductive cycle, we are actually talking about the cyclic events that occur during the reproductive age of the female in the uterus and the ovary, and is characterized by release of an egg or ovum plus menstrual flow. Actually, this cycle is composed of two cycles. One is called the ovarian cycle plus the uterine cycle. So these two cycles form what we call the female reproductive cycle. So when we talk about the ovarian cycle, we are actually talking about the cyclic release of an ovum from the ovary. And then when we talk about the uterine cycle, we are talking about series or the cyclic events that occur in the reproductive age of the female in the uterus and is characterized by menstrual flow, and it occurs every other month. So the first menstrual blood or the first menstrual flow, a female say, it's normally termed as menarche, and the cessation or complete stoppage of the female reproductive cycle is termed menopause, and at this age the female can only conceive by miracles. So if we dive deep into this subject today, this cycle is actually controlled at 4 different sites or 4 different levels. One, the regulation or controls occurs at what we call hypothalamus. Then the second part where regulation occurs, it's actually the anterior pituitary glands. And then at the ovary or in the ovary itself, then lastly at the uterus. This cycle, this female reproductive cycle, is actually controlled by a series of hormones. So today we shall look at these 3 cycles independently, but at the same time or concurrently during this discussion. So at puberty, or when the female has reached the pubertal age, we start with the hypothalamus. So what actually happens at the hypothalamus? Hypothalamus begins to secrete a hormone, and this hormone that is being secreted is called gonadotrophin releasing hormone. Where does this gonadotrophin releasing hormone go? This gonadotrophin releasing hormone, it goes to the anterior pituitary glands. Then it begins to stimulate this gland, and this gland starts to secrete 2 kinds of hormone. One is called follicle stimulating hormone. Then the second hormone is called luteinizing hormone. Where are the action exerted? This hormone from the anterior pituitary gland will actually go to the ovaries. So when they go to the ovaries, normally at reproductive age of a female, each month about 10 to 15 primordial germ cells are recruited to begin development so that they are released. So these germ cells to mature or to continuously grow, they normally require follicle stimulating hormone. Now the follicle stimulating hormone at the ovary, it begins to stimulate the developing follicles to continue undergoing their development. And since we say we are going to look at both the cycles concurrently, so I'll write this side ovarian cycle, and this other side we shall have uterine cycle, because these 2 cycles actually have phases that occurs. Now the follicle stimulating hormones begin to stimulate the ovaries, and what does the ovary do? It promotes the development of the follicles. Since the follicles are growing or they continuously grow. That constitutes the first phase of the ovarian cycle. And the first phase of ovarian cycle is called the follicular phase because it's characterized by the growth of the follicles. And this is what is actually occurring at the ovaries. So what happens? Now, these follicles, which are actually growing, they begin to secrete another kind of hormone. Which hormone is that? The hormone that is being secreted from the ovary by the developing follicle is actually called the estrogen. The estrogen are secreted by the developing follicles. This estrogen has action, one, on the hypothalamus, and two, it also has an action on the uterus. So let me start with its action on the uterus. So this estrogen goes to the uterus. And what does it do to the uterus? It begins to stimulate the endometrial lining of the uterus to begin proliferating. In other words, the growth of the endometrial layer of the uterus starts under the influence of estrogen. So that one constitutes a phase in the uterine cycle. The first phase, I will skip it. I will explain it at the end. But the second phase that occurs is actually, maybe I just mention this and explain later. The first phase of the uterine cycle is actually the menstrual phase itself. And we shall come back to this towards the end. Now, the second phase that occurs is actually under the estrogen are being secreted by the developing follicles, and this estrogen stimulates the uterus to proliferate. And because there is proliferation of the uterine walls, we call that one proliferative phase. Proliferative phase. So in the ovaries, we have the first step as a follicular phase. Because the follicles are growing, these follicles stimulates, release estrogen, secreted, goes to the uterus. But at the same time, this estrogen that is being secreted has another kind of action on the hypothalamus. So it has an action on the hypothalamus. Which action? Now the follicles that are growing, they are still a little bit not yet very mature. So the level of estrogen that is being produced is low. Now, this hormone estrogen at the hypothalamus, it has two kinds of action. One, at low levels of estrogen hormone, at low levels, it exerts a negative feedback to the hypothalamus. There is negative feedback to the hypothalamus at low levels of estrogen. Now, as estrogen negatively inhibits hypothalamus, it means gonadotropin releasing factors are inhibited, and in turn, the levels of follicles and luteinizing hormone will reduce. So what happens? It means that the very many follicles which were initially growing under the influence of follicles will begin to degenerate or disintegrate. And only the one which had grown and has good quality can thrive under low levels of follicle stimulating hormone, can actually continue its development. So, in other words, this negative feedback is to cause what we call selection. So, the best follicle which had matured will be selected for, and it will continue growing. So, as it's continuing to grow to form a Graafian follicle, it continues to secrete more and more estrogen. So, it means the estrogen level in turn will go higher. Now, at higher concentration of estrogen, there is a positive feedback. At a higher concentration, so this time around, we have our estrogen. Let me use another color. Our estrogen level has gone relatively higher. So this time around, the estrogen will cause a positive feedback. A positive feedback. So we have a positive feedback at high concentration and a negative feedback at low concentration. Now, this positive feedback in turn will promotes the release of gonadotrophin releasing factors. In turn, it stimulates the anterior pituitary gland. It causes more follicle and luteinizing hormone to be secreted. As more follicle and luteinizing hormone is secreted, it means at the highest peak, or there will be a surge of luteinizing hormone, and it causes what we call ovulation. When ovulation occurs, we actually leave behind a yellow body. A yellow body. And that yellow body is what we term as corpus luteum. Corpus luteum is being formed. When ovulation occurs, we have what we call corpus luteum has been left in the ovary. Now, since corpus luteum has been left in the ovary or the ovarian cycle, we go to the second phase. And that second phase is called the luteal phase. In other words, the follicular phase ends immediately after ovulation, and then we start the luteal phase of the ovarian cycle. Actually, the ovarian cycle has only two phases, the follicular phase and then the luteal phase. So what happens with the corpus luteum that has been formed? This corpus luteum also begins to secrete a hormone. And the hormone that it secretes is called progesterone or progestation. Progesterone. What does progesterone do? The progesterone will go to the uterus. And what does it do to the uterus? It promotes growth of more and more blood vessels towards the uterus. Two, it makes uterine glands to further proliferate, or formation of more and more uterine gland. Why do we need uterine gland? For secretion. So at this point, when progesterone are being released, causing more growth of endometrial layer, more blood vessels come in, more uterine glands are formed. So secretion in the uterus is possible, or it increases. So now, during this phase, we term that as a third phase in the uterine cycle. In the uterine cycle, we shall have what we call secretory phase, because the uterus has more glands and it can secrete more and more uterine milk. Secretory phase. Now what happens? In case fertilization occurs, the corpus luteum that has been formed will persist for about 10 to 12 weeks, so that it gives time to the placenta to mature, so that it continues producing more progesterone. However, if there is no fertilization, or fertilization does not occur, the corpus luteum will degenerate after about 10 to 11 days after its formation. After degeneration, it means progesterone will go down. When the level of progesterone go down, there will be spasms of the blood vessels which were initially formed within the uterus, or which were initially enriching the endometrial layer. Now, as these spasms occur, there will be ischemia of the inner lining, the functional layer, the endometrial layer. There will be what? Ischemia. And that's when we start seeing what we normally call pre-menstrual symptoms. And this phase where those activities are occurring is the fourth phase of the uterine cycle, and then we call that one pre-menstrual phase. So after pre-menstrual phase, ischemia has occurred, the cycle ends, and then the next cycle starts with the shedding off of the menstrual blood, or the endometrial layer shades off, and that becomes our first stage of the menstruation. Now, to answer our question, is it possible for an individual to conceive during the menstrual flow? Let's look at this as we dive deeper into the ovarian cycle and we answer that question. Okay, when we look at the ovarian cycle, it has two phases. The follicular phase, where the follicles are actually growing, and then the luteal phase. This will be what will determine the answer to the question that we initially asked. Now, how many days do we have this female reproductive cycle actually lasting? Normally, it takes between averagely 28 days. But as you should be aware, we do not have a fixed or a constant biological figures. So this phase takes approximately 21 to 35 days. So if an individual is taking 21 days, that individual is absolutely fine. And then there are those people who actually take longer days than the other, and they will be able to take about 35 days in this cycle. But I told you, this cycle is divided into two. The first phase is the follicular phase, where the ovum will be released. And then the last phase is the luteal phase. For fertilization to occur, we must have both the sperm and the egg. And that's what we are actually striving to get. Now, if we look at an individual that takes averagely 28 days, this is day 1, and then 28. So this individual will take day 1 to day 28. And they will be able to release the eggs, or the ovum will be released averagely at the center or midway the cycle. So about day 14, we shall have our ovulation occurring here. But important thing or important point that I want you to note is that during the follicular phase of this cycle, it's where the variation of days actually take place, because the growth of these follicles vary from individual to individual. It may be affected by hormones, it may be affected by stress levels, it may be affected by dieting, it may be even environmental changes that an individual may go through. So these are the particular, or the first phase of the ovarian cycle is never constant. However, after ovulation has occurred, the last part of the cycle, which is the luteal phase, is relatively constant or approximately constant, because we say when ovulation has taken place, the corpus luteum will persist for about 10 days, and then the other 2 days will be the days of the premenstrual, and then the cycle will actually end. So to keep that constant, it means that if we bring the same concept to this individual who takes about 1 to 28 days, keeping the fact that the last phase of the cycle is fairly constant, it means that this individual will actually ovulate. This is not 28, sorry, 21 days. It means that this individual will actually ovulate at day 7, not day 14 as for the case of this one, because we said it is normally the last day that is fairly constant. The first day is variable due to a number of factors. But if we have this other individual who takes longer than the other, this one takes day 1 to day 35. So this individual who takes relatively longer days, keeping in mind that the last phase is relatively constant, it means that this individual will ovulate at around, have it happening on day 20 or on day 22. The same thing will happen to this individual, ovulation occurring on day 6 or on day number 8. So after ovulation, how long does actually this ovum last before degenerating, or what we call dying it away? So this ovum can take about 24 to 48 hours before degenerating. So it means that is about 2 days. So it means day 16 and day 17, we may still have that egg on that person. And then on this individual, day 23 and day 24, we shall still have the ovum. And then here, day 9 and day 10, we shall still have the ovum. So these particular days, when the ovum is present, is actually what we term the fertile window. However, the sperm factor actually adds more days to fertile window, because after release of the sperm can actually thrive for 3 days. That's about 72 hours. So if it can thrive for about 3 days, 72 hours, it means it can be released and then it patiently waits. When ovulation occurs, then fertilization will take place. So when we add that into our days or window of fertility, this is what will happen. We say 72 hours. So this one, it means this will be on day 12, this will be day 11, and this will be day 10. And then to this other individual, this will be day 5, this will be day 4, and this will be day 3. And then this other window, this will be day 21, this will be day, not day 21, day 19, this is day 18, this is day 17. So this is what we term the fertile days, or during this period, when you have intercourse, the chances of conceiving is higher. So there is more likelihood of having babies or conceiving. This is fertile window. The same thing happens to this other individual. So this is the period that you should maximize to increase your chances of conceiving. So the last question which we are supposed to present or to give an answer to, is it possible for someone to conceive during the menstrual flow? Let's have an answer to that. Now, if you can remember the phases of the uterine cycle, the first being the menstrual phase, the second being the proliferative phase, the third being secretory, and the last one being premenstrual. So now, during the menstrual phase, there is shedding of endometrial layer, and that's what we see as menstrual flow. That phase takes about 3 to 5 days. So a female sees blood for about 3 to 5 days. And that is actually what marks the first day of the cycle. So on day 1, that is when the female first sees the menstrual blood. So if we go back to this individual, it means on day 1, this is when this female will start seeing her blood. So possibly she can bleed day 2, day 3, and stops there. Or can go to day 4 up to day 5 and stops there. That is the end. Then to this individual, he can also see blood to day 3, day 4, up to day 5. That's what is considered actually normal. Now, if you are an individual who falls here, it means you will probably see your menstrual blood or menstrual flow from day 1, day 2, day 3 possibly. So when you stop on day 3, you can actually see blood up to day 5. So in other words, the menstrual flow is actually overlapping with the fertile window. So you got the answer to what you wanted. Thank you. I think you have gotten an answer to the question that we had initially. Thank you for attending. See you in the next episode. Have a good day.